Yeah. Okay. Good afternoon, everyone. I am Amy Mitchell with Houses of Windsor, and this is Virtual Tea Time with Amy and special guest with Dr. Bob Rosenberg and Sheri Rosenberg. And today we'll be talking about what he does, what they do, and some fun facts about them as well. But to get started, Dr. Bob, and Sheri, where are you guys calling from?
We're actually at home in Winter Springs, Florida.
Okay, very nice. And I'm over here in Altamont Springs, not too far. And let's see, what are you drinking today?
We are drinking your vanilla chai tea.
Wonderful. And what do you think of it now that you've tasted it?
Very good.
It's good? Nice. Thank you. What am I doing today? Oh yeah, I'm doing the French blend. I forgot for a moment. Piper likes this one, actually. This is the first one she tried. And I let her try it thinking she would think it was gross because she wanted to drink what I was drinking. I was like, all right. And she just started like slurping the whole thing down.
Never know.
Yeah. I was like, all right. Just a little bit of caffeine. But okay, cool. So we covered tea. So I want to ask, well, first I like to say how we know each other. So I know you, Dr. Bob, because I know Sheri, because of the BNI chapter. So for those of you who have heard me before, like yesterday, Jeff Singletary on, another BNI member. So I've got a great network of people, and Sheri is in there representing Rosenberg Chiropractic. And so I guess first of all, if you'll give me just a little brief summary of your practice and like how long you've been there and everything, and then we'll get into the backstory.
Okay. I'm practicing chiropractic for about 30 years now in Longwood. We've been at the current location off of Ronald Reagan and 434 in that region for about 20 years. Before that, we were further north on Ronald Reagan, on 434. My practice is primarily focused on helping patients empower themselves. And we do treat low back pain, neck pain, and do spinal manipulation manually, and also use an instrument called the ultraline, which reduces the popping and cracking that many people may find offensive. And also gives us a way of measuring exactly what we're doing. Spinal decompression, do rehabilitation, we treat auto accidents, but we primarily treat family and friends. That's our focus.
Okay.
We educate people and empower them to take better care of their spines.
Okay, so how did you get into chiropractic?
Okay. At the time, I was actually a paramedic. I did that for about almost 12 years.
Oh, wow.
I had a positive experience with a chiropractor when I had some neck pain when I was in high school. I got injured and ended up going to, I actually started in orthopedics at first, and I ended up getting put in a hospital for a weak contraction.
Oh,
And then
wow.
re-injury, probably a year and a half later, went to see a chiropractor and didn't need to be hospitalized, and actually had a very positive experience. But what really got me involved was Sheri, because she was involved in a traffic accident. She had migraine headaches before the accident happened. She was working with two medical practitioners, and nothing seemed to help her. Her migraine headaches got worse. She had neck pain and back pain. And then she went through the typical algorithm, which is she saw a physical therapist, she saw an orthopedist, she saw a neurologist. Nothing seemed to help. And as a last resort, I said, well, look, what do we have to lose? Let's go see a chiropractor and see what happens. Make a long story short, she started to get better, and she got better very quickly. And I asked the chiropractor, what were you doing that was so different? And I started to learn more about it. And next thing you know, I was actually doing my undergraduate studies. I wanted to go into medical school. I wanted to go into either become a trauma surgeon or an ER doc, and took a 180-degree turn and went into chiropractic. Because I started to recognize the body's a self-healing, self-regulating organism. And those things that interfere with the body's healing, the body will heal. And so it's not a completely different path, but certainly one that I felt was more empowering.
Right. Wow. Well, I love that story. That's very interesting.
We packed up our we packed up our 2 kids, sold the house, moved everything, and moved to Atlanta, Georgia.
Oh my goodness. Okay. Wow.
That's where we went to. That's where I went to school. Was at
Yeah.
Life Chiropractic in Atlanta,
So where were you before Atlanta?
Philadelphia.
Oh, okay. Okay. Wow. So Sheri, you said you were working, or he said you were working for doctor's offices beforehand, right?
Yeah,
Yeah.
I actually was a medical assistant
Oh, okay.
by schooling. So there was 2 osteopaths.
Mm-hmm.
And they opened up a medical center that like Dr. Bob said, had an orthopedist, neurologist, and a physical therapist there.
Mm-hmm.
And once I finished that rhythm and the drugs and everything they gave me, it wasn't helping me. So chiropractic did. And then shortly after that, I got pregnant.
Wow.
So then I stopped working, but
Right. Right.
he
But-
continued on.
But so now that you work, with Dr. Bob, it's your practice. Is it like similar things of what you were doing back for the other, like at the other places, or no?
Not really. I wasn't the reception. Here I'm the receptionist and the office manager because I like to talk to people. I guess that's why I have to get up at 6 o'clock on Wednesday morning to go.
Right. That's why you're in BNI.
Yeah, for 14 years.
Right.
But previously, I would be the nurse that was doing all the blood work and the cardiograms and all the breathing tests, and I worked in the back office.
Oh, okay. Okay. That's cool.
But when we met, I actually was his nurse on the back of the ambulance. That's how
Okay. That's what I was gonna ask. Yeah, that was the next question. How'd you meet?
When I was in school to become a medical assistant,
Mhm.
they told us that we could actually go and work on an ambulance as EMTs.
Yeah.
That's what it was. And they said to go volunteer in Philadelphia where we lived. It was a volunteer ambulance that you had. You didn't have all those years back.
Yeah.
So my girlfriend and I went, and we started off by taking blood pressures in the community, and in walked Dr. Bob and his friend. And that was it. I was actually, he winked at me while we were taking a patient up in the hospital in the elevator.
Oh
And
my god, that's adorable. I love it. Can I ask how old were you when that happened? Both of you?
I was 19.
Yeah, you were 19. I was 22.
Yeah. Oh my gosh, that's awesome.
Here we are all those years later.
Right. That's really great. So do you miss Philadelphia at all, or Atlanta, or are you happy here?
I miss family up
Mhm.
there, although there's not as much family anymore. A lot have moved.
Yeah.
Philadelphia, I don't miss the weather. The
Yeah.
weather down here is nice. People down here are nicer. I
Mhm.
talk, everybody talks to you.
Right.
Supermarket all over, where up north they're just in too much of a rush.
Okay. Yeah.
I like it down here.
Right. Yeah.
I'm
I
happy.
agree. I'm from Indiana. Not that everyone's in a rush there, but I just like the weather here
Yeah.
and the vibes.
Yeah.
Yeah. But that's
Like more relaxed.
mhm. So, do you have any crazy stories from your paramedic days?
Oh, lots of them.
Yeah. What's one of your top ones? What's one of your top favorite ones to tell?
Hold on, Sheri will tell you hers.
Okay.
What's fun? I didn't know I had one. Oh, well, it's kind of a little freaky, but
Okay.
we have been called over to a house where a person had not been heard from. It was over Christmas, 2 days. We went in, and unfortunately, he had passed away.
Mm-hmm.
Being Christmas, they asked the ambulance if we would take them to the hospital rather than having the coroner come out on Christmas.
Oh, yeah.
So we did, and it was a rather big guy, and Dr. Bob and the driver covered the person and put him in the ambulance, and they hit a bump.
Oh no.
And the gentleman's arm came out and grabbed my leg. And it was not what I'd say a pleasant experience.
Right.
On the metal, on the motor in the middle of a van. The rest of the way to the hospital. I stopped running after that.
Yeah.
I don't know this.
That's hilarious.
that was, I guess that's what happened to me.
That's a nice creepy one.
Yeah.
That's good. So Dr. Bob, do you have one that you want to share?
Not that I can think of that's really humorous.
This was,
Um,
this was
yeah.
a dead person that
It
got
really
away.
depends on your
yeah,
perspective.
or anything, yeah, or something most
funny.
gruesome. Do you have something that's like super gross?
We used to do a lot of trauma,
Mm-hmm.
and there was one time when we took an auto accident, and there was a person that hit a power line,
Mm-hmm.
and I got into the back of the vehicle to help the patient and secure them, and the power box, I guess the transformer box fell. There were live lines. So it was a good thing I was completely inside the vehicle.
Whoa,
Otherwise, I wouldn't be talking to you.
that's what I was wondering. Yeah. Oh my gosh. Jeez. So that's crazy. So what, did it fall? It fell on the ground?
Yeah,
Or
it
it
fell on
fell-
the ground, but the wires went across the front of the car.
Oh jeez. Oh my gosh.
Yeah.
So stuck there for a little while.
That's what I was gonna ask. Is like how long did you're
Yeah.
just stuck there? Wow.
Yeah.
Well, yeah, that's a story.
So somebody made a mistake in terms of said it was secure, and it wasn't secure.
I see. I see.
We wouldn't have gone into the vehicle.
Yeah.
I wondered. Okay. Yeah, what people do with that.
We even had one scene where we were called to an accident, and they told us that the car was on its roof. So, the first thing you do is look for the patient. And then
Yeah.
we go up, and he and I both hit the ground looking for the patient all over and inside the car. And we hear, woohoo, woohoo. Look, it's a skunk sitting on top of the car, on the underside of the car, waving at us. I'm up here,
Oh my gosh.
oblivious to what had just happened.
Right. I had no idea.
So great to drive.
Jeez Louise. That's good. So, okay. So we're going to talk more about chiropractic, and we'll talk about, the current situation of social distancing. But I heard that you have a fun fact that not a lot of people know about you.
That's
What is
true.
this?
When I was home with my my oldest daughter, of course, you watch TV.
Mhm.
And Bob's brother and sister-in-law had also just had a child. So the two my sister-in-law and I were very close. We would always watch Family Feud.
Mhm.
And they came on and said that they were interviewing in our area.
Okay.
So we registered and signed up to go try out for Family Feud. And we got there, and there had to have been over 1,000 people.
Mhm.
And first question they ask is, at the time it was Richard Dawson, would you mind if he kissed you? And if you said yes, then you could go through. If you said no, then they asked you to leave. Kissing everybody at the time.
Yeah.
It was Robert and myself, his youngest brother,
I did refuse to
My
let Richard
sister-in-law.
go.
and Bob's mother. So they sit you in this room, chairs lined up,
Mhm.
40, 50 rows, whatever it was, however many people there were. And we're sitting towards the back, and we're kind of practicing. And the question was, name something with claws.
Mhm.
I yelled Santa. Well, that wasn't the clause that they said.
That's hilarious.
You're talking about animal claws.
Yeah, I know. It's like, my first thought was like, cats. Like,
I thought that would
lobsters.
disqualify right there. But no, that's what they're looking for.
Yeah, that's so good.
Went row by row by row, all the way up to the front. There was that round where you had to be fast and answer the question. So that's,
Right.
But when we finally got up there, I don't know how many people know that Dr. Bob is a twin.
Oh, okay. I keep forgetting that. I do know that, but I forget it every
He's the youngest of the twin.
Mhm.
And the first question we went, it was my mother-in-law and Robert, his brother Louis, Sandy, who was his wife, and then myself. And they asked the first person, what comes in pairs?
Mhm.
And either my mother-in-law or Robert or his brother knew that the answer was twins.
That was number one.
Yeah, that's great.
That's socks.
They had socks, they had shoes, and that was not what they wanted. They wanted twins.
Yeah. Oh my goodness.
And then they came up So we got disqualified after that, but we had a good time.
That's really fun. Yeah, so you weren't filmed, but it's kind of like you got a
No.
taste of it.
Yeah. Yeah.
Oh my gosh.
It was a fun experience.
Yeah, that's really fun. So, okay, so Dr. Bob, what do you want to, I guess, share with everyone about like things that they should know that maybe people don't know, or like, you know, specifically what you do? I mean, I know you mentioned the ultraline, which is, you know, not what the average person knows about, like when it comes to chiropractic care. So, yeah, I don't know, just kind of what would you like to share?
We have one spine, and it has to last us a lifetime. When we talk about the importance of something like posture, different pressures on the spine, and it actually, it's kind of like a car tire. If a tire goes out of alignment, it wears. Well, the same thing happens with the spine. So when we look at people that are spending a lot of time in front of a computer, or who are texting with their faces down on the phone, we see a lot of that today, and a lot of problems that we used to think were kind of like, quote, older people problems are really starting in the younger generation because of this dynamics of posture. So by being able to change that posture, first, the most important thing is recognizing that there's a problem. And once we recognize that problem, do something about it. And chiropractic is a great way to start. We can talk about those areas of spine which are a problem. And my focus is to take it beyond that, because I think that one of the definitions of a physician, and a chiropractic physician, is really educator. It's about educating people about what they can do to make a change. And I tell my patients from the very beginning, I'm not a body shop. They're not going to drop it off and pick it up. We're going to work with them to teach them what they need to know so they have a healthy spine. I think that's really important, is the educational component. And I did some videos. I know you and I talked about video for setting up a home office.
Yes.
In these, and I actually did them, but I'm having some problems with the editing it out.
Okay.
So afterwards, I guess we'll talk about that.
Yeah, we can do that. Yeah.
But setting it so that we're in a neutral position. Actually, I'm working off of the surface grow. We have it propped up on a book so that we can actually sit in a neutral position and be comfortable.
Okay.
I think that's important. And asking questions, I think that's, for me, I don't think patients ask enough questions.
Okay.
Whether it be their chiropractor, whether it be their primary doctor. And I tell all of my patients, before you go and see your doctor, get a little notebook and write down some questions.
Right.
What is it that you want to know? What are your symptoms? Give them all the information, because I don't know how many times I'll hear from patients who say, you know what, I sat down and I had this problem. I saw my primary, and I forgot to ask them about this.
Right.
And that's a very common thing. And if you wrote it down, you wouldn't forget to ask.
That's a good tip. Yeah, because it's also like, especially primary care, you don't see them very often. So it's like they're not mind readers. Like you gotta give them some kind of insight into what's going on.
And most of the examination is in the consultation. Again, as a practitioner, you get a lot of information by just asking the right questions. And you can formulate probably 85% of your diagnosis just by the communication.
Right.
So it's important. So what you tell them is important. What you don't tell them is equally important.
So can I ask you, you know, you mentioned how with tech neck, how it's, you know, affecting younger generations, what used to be more of an older thing. So is it very similar? Like I know I've seen older people that have like, you know, it's almost like their neck is pushed forward and their, you know, neck's kind of out. Is it basically the same thing as like what's happening to young people with tech neck, or is it a different, I guess, result? What's happening?
It's the same. Well, they're a little bit different because there are different variations of that. For example, there's been an auto accident, may develop a loss of the cervical curve, and that curve, that C-shaped curve in the spine, actually can shock absorb. It's like a spring. When they lose that springiness, and that can lead to degenerative problems, which can cause pinched nerves, which can cause disc issues, etc. You can do the same thing over time. We call it the difference between what is a micro trauma and a macro trauma. A macro trauma is the car accident. A micro trauma is sitting every day in this position with your head flexed. over time. It's traumatic, but it's a little bit at a time, which eventually leads to a potentially long-term problem. What we're also seeing, interestingly enough, is if you reach the back of your head and feel a little bump in the back here,
Yeah.
that's called the external occipital protuberance.
Okay.
There are muscles that attach to that. Anytime a muscle attaches to a bone, that's the tendinous attachment to the muscle to the bone, as that pulls, the body can actually lay down calcium so it doesn't pull apart. They're called osteophytes. That particular situation can happen, and they're starting to see changes in younger people where they're actually developing what they call a horn. It's not truly a horn, but they're actually seeing a bump back here, and it's actually bony growth in the back of the neck because the neck is always in a flex position. Wow. So that's fairly within the last 3 or 4 years they've actually seen that. So this has been going on for quite some time. For that to actually develop, it takes several years for that to actually develop. But that becomes permanent. You're not going to change that. Okay. I say that the likelihood is that if you make certain changes, there's a potential for it to be reabsorbed. But it's certainly better to prevent it than not. Okay, and that also comes from the bump in the people that between the shoulder blades where you see the head care. A lot of that, now patients ask me about that, a lot of that comes from posture. Okay. Like in tall, if the muscles here are too tight, they're going to pull the shoulders forward. It's going to pull the head forward. The pelvis is actually going to be shifted, and that's going to create that anterior head carry, and that's going to make it seem like there's a lot of bump back here. Whereas if you stretch this out, get it back in the neutral position, get you up more upright, you won't see it. It won't be as noticeable because it's not truly what they call a dowager's hump. It's not truly a kyphosis, because when you see a true kyphosis, it's because the vertebrae have actually in the front have collapsed and wedged, and that's so this is more postural. This is much more changeable to me, treatment compared to something that's a wedged vertebra from a fracture. Okay, so most likely, like, they can fix it. They just have to. Is it more of a posture and certain exercises that you like show them how to do? Correct. So you have to identify what's causing it. So I would go through and evaluate the patient's posture, evaluate their balance. At any age, it's going to be the same focus, and the vertebrae, make sure they're moving appropriately, and then teach them the exercise they need to do, and the ergonomics. That's sitting in front of the computer, sitting at a desk at school. Those are all important things. I have a patient who was a baseball player. A lot of low back pain, and he thought it was from his swing, and it really wasn't from his swing. It was the way he was sitting in school at the desk. Really? That was a bigger issue for him. And so when we taught him how to sit properly at his desk and change some of the things in his dynamics and adjust it with time, he's doing great. Oh my gosh, wow. That's interesting, because it's like if you're an athlete or working out or whatever, if you feel pain, you assume it's because of whatever activity you're doing, you're not thinking about the inactivity. Correct, exactly. So, and I think that's what it means to be holistic, is that you've got to look at the whole picture and look at the whole person, not just identify one little area and figure out you're just going to treat that. You have to treat the entire patient. So do you want to talk a little bit about the Ultraline? Because I think that's a pretty cool piece of equipment that you've got there. A pretty cool tool. The Ultraline is a technology that was introduced probably about 10 years ago. It is a computerized impulse device that actually measures motion of the spine. Developed in the aerospace industry. They're looking for taking an airplane wing. They tap the wing and measure the measure the echo on an oscilloscope. And as it percusses, feeds back information, then you know whether or not, in the case of the airplane wing, whether or not this echo is accurate. If there's an inaccuracy or flaw in the echo, then you know that the fatigue is not, there's metal fatigue, and there's a problem with that. They took that same technology and were able to identify in the spine normal motion of the spine, what would be normal, and created a whole series of normals. And we can actually measure that using the same instrument, which has I'm using my fingers like it's a prong. It has 2 points on it, goes on either side of the spinous process, and measures all the way down the spine through each of the vertebrae. And as it does that, it'll get feedback and we can graph it, see what it is, go back and actually make the adjustment, either using the instrument or manual therapy.
Okay.
And then go back after we've done the treatment, go back and remeasure to see whether we made a change.
Okay.
So the value to that is A, you get to document what's going on. The patients get to see before and after to see the change. And so it adds to a lot of, it's a valuable tool to be able to measure and determine what's going on with the patient.
Right.
Identify it and treat them accurately.
It's really cool. And I don't know, I forget how you would describe it, but like the actual pressure of it, I mean, it barely feels like anything. So like anyone out there listening that's like afraid of something like poking at their back, it doesn't feel like that at all. It's like
the initial percussion.
Percussion, yeah.
Initially percusses. Use my hands down here behind. Yeah. Can't see that. When it initially percusses, it actually is about 6 pounds to actually create that percussion frequency.
Really?
Really very, very, very light.
Yeah.
When it treats, it goes up to about 20 pounds, which isn't much. It'd be like putting pressure on your palm of your hand.
Right.
Tapping it. That's what you feel.
Right.
But it does it at a specific frequency. In other words, how rapidly it moves. That is actually what transmits a signal to the vertebra, to the receptors in the joint itself, to tell them that they need to change.
Oh, okay.
And that information now is how it does the treatment.
Okay.
And then we put patients on the right exercises.
Yeah.
Talk about ergonomics, whether it be somebody who's working all day at a desk or in front of a computer, or somebody who's driving a truck all day in a high vibration situation, or a patient who is a patient actually travels to work for 2 hours from where he lives, 2 hours back, 4 days a week. So it's no wonder he has back pain.
Yeah, no kidding. Yeah. Piper's talking over here. Piper, what do you need? You've got it right there.
Maybe she has a question.
Yeah, do you have a question, Piper? She's asking for more cheese, but she has macaroni and cheese right there on her plate. That's hilarious. So sorry, anyway. This is what working from home now is. With everyone stay at home. Like, you're working at home, the kids are around. This is what it is.
My kid around when I'm trying to do work.
Right. Yeah, I forget. Do you guys have any pets? Do you have anything running around the house there?
Not anymore. One time we had 3 cats and 2 dogs.
Oh, wow.
Not all at the same time.
Well,
okay.
We had the 3 cats.
The 3 cats at the same time.
1 dog.
Yes.
The last dog we had was a rescue, and we only had him for a short amount of time. He had been abused and actually had lost the use of his back legs.
Oh, geez.
We had Heartwood.
Yeah.
Oh. Yeah.
They had a lot of other health issues.
And we took him to a vet that was a chiropractor. And we worked with him in the pool, and we got him walking again, but then it happened the second time. And by that time, both girls were married in a way and actually having their babies already. And we were doing a lot of traveling up to Boston and Baltimore to see the grandkids. So at this point, we don't have any.
Right.
We both just haven't decided that yet.
Yeah. But that's interesting. Yeah, you could do the physical therapy in the pool with them, and
we did extremely well. The first time, because it was in the spring and summer, so I was able to get him into the pool. We had a little harness for him. And
we swam with him
twice a day, and he did extremely well after getting adjusted and recovered. But the second time he didn't recover from it. I've had one that say a lot of it may have been because he actually may have had something affecting the bone itself, and that's where he herniated the disc or had a fracture.
Okay.
From either the medication or getting the hot room.
So I know. Oh, sorry. Go ahead. What were you gonna say, Sheri?
I said we do love animals and we like them.
Yeah. Well, I guess this is before we were recording, so but you guys got to see Lord Williams. He wandered across here. The other one is hiding. He doesn't usually make a cameo appearance. Not on camera, but yeah. So I guess what do you have? Because I know, Dr. Bob, like you've been following like the CDC and like just a lot of kind of researching, trying to follow everything going on with coronavirus. What would you, I guess, like to share with people?
Continue to socially distance and wash your hands. Follow those things that are important to do that the CDC has put out. I know that everybody's anxious and everybody wants to get back to work, but doing it too soon could be a problem. And I think we have to recognize that. And so a little bit at a time, being careful and just following the guidelines.
And I was going to say, I know that with our office, we are seeing patients, but we're doing one patient at a time. That from the time they come in and touch the doorknob till they leave, Jamie and I follow, and we clean every area. So, you touch the doorknobs, you sign in, or we'll sign in for you. There's no sitting next to anybody if somebody should walk in. Once you're there, we really don't let anybody come in, but sometimes they'll come in with somebody. We ask them to sit separate from each other. They go back, we clean every table that they're sitting on, every chair that they're on. And even though the patients are out and about, they tell me that they appreciate it. They don't mind kind of us stopping them and cleaning up and all that. It just makes everybody feel better.
Right.
You just have to take the precautions in life in the same way.
Right. And I think that's great. Yeah, that's what I was going to make sure you, told everyone that you guys are still seeing people, but you're, taking all the necessary precautions. And I think that's smart.
Everybody's doing more stuff at home where they're just stressed, and whatever it is, it's causing them pain and discomfort. And it's hard to do daily activities when you're feeling that way. So we're still able to see patients.
And I'm telling patients to call. And I'll be glad to talk to them and give them some advice. They can tell me what's going on with their situation, with the pain, and we can talk about how we can probably alleviate some of that at home if they can. And when it really becomes a situation where you've got to come in, I've got to see the patient.
Right. Okay.
So they'll treat for some of those things, some of the real aches and pains that we have.
Okay. So I know we're going to do some videos later on our own, but I guess I want to know, do you have any quick tips for people who are like binging shows and sitting on the couch?
Ozark,
gosh, yes. I don't think she's looking for recommendations.
Yeah, I know. It's like, how should they be sitting on the couch?
Just like you sit in the chair, supported. Make sure you're supporting your low back. I probably the biggest problem binge watching is falling asleep while you're watching.
Oh, yeah.
You're in some kind of awkward position. If you're sitting up, especially if you're sitting up in a recliner, you fall asleep, your head's on the side, and then you wake up with a stiff neck.
That's true. Yep.
That's the thing to be careful. Just use pillows to maintain a little bit of support each side.
Right. Yeah, get your airplane pillows out since you don't need them. You don't need them for flying right now.
Just like you would if you watch it, just like you would if you were working. I tell patients that every 20 to 30 minutes to get up and do a micro break.
Okay.
Stand up and stretch, reach up above your head, turn to the right, your left, rotate, and just take a little micro break, get some movement, do some marching in place, and get movement of the sacroiliac joints, and then go back to it. You can do the same thing when you're watching the TV.
Okay. Yeah, that's good to know. I definitely need to do that when I'm working because I'll just stay seated the whole time. If like she's actually asleep and I can work, I just keep going. You say hi? Can you wave? She brought her fork over. Oh wow. Well, hey. We're not. Yeah, you're not supposed to be doing that right now. Don't spin on people. People don't want that. Yeah, I guess you can spin on me.
We'll stop having people blow out birthday candles for a while.
Oh, you're right. Yeah.
That was a disgusting habit.
Right. Right. I know. Yeah, especially when they're really little and they don't know what they're doing. Like they're just spitting on the cake we're about to eat.
Any birthday cake.
Yeah. Are you going down? Okay. But so let's see. I like to ask, is there do you have any final words before we wrap up?
Yes, we've talked about this before, was
Yeah.
the thymus
Oh,
gland.
right. Yes.
And the thymus gland is located right here.
Mhm.
Hold on.
Okay.
It's
Yeah.
located right here. Starts off when you're an infant as being very big. And as we get older and older and older, it shrinks down and becomes, they thought by the age of 65 to 80, it was actually completely fatty tissue. It was non-functioning. But what's been discovered recently is that it's still a function. So the importance of that is that's the beginning of the immune system, and T helper cells, the T cells come out of the thymus gland, become the seed cells to bone marrow where the rest of the cells are produced, that in our older age actually becomes the center of our immune system rather. But if we actually were to percuss that and just take our hands, cup it on our chest, do that,
Yeah.
that stimulation will help stimulate T cells.
Okay.
Help with increasing your immune system. So it's a very simple thing. You have to start pounding on your chest. You're not Tarzan.
Right.
Just a simple percussion, and do that about 3-4 times a day for about 15 seconds. It feels pretty good, and it'll stimulate your immune system. So live long and prosper.
I love it, Sheri.
So that's my new greeting.
I love it. I don't know if Sheri does.
Yeah, 43 years, I just shake my head.
That's what I was going to say. Yeah, it's like, how many years has it been now?
2 weeks will be 43 years.
That's right.
In 2 weeks?
Yep.
Oh, that's
Maybe.
awesome. That's awesome. Well, early happy anniversary.
Thank you.
I feel like I've already lost track of what day it is. It's already, I mean, we're already pretty much through April. It's, yeah, I feel like it just got here. But time is all blending together
Actually,
now.
it seems like it's been 2 months since we're all quarantined together.
Yeah. It's like, I feel like I don't remember the time before this. This is all we've ever known. But, okay, well, Sheri, Dr. Bob, thank you so much for being on here. We'll say our goodbyes, and I'll end the recording, and then I'll see you backstage.
Okay.
Bye-bye.
Bye.
Okay. Yeah. Piper, you want to shout bye? She goes, no.
Okay.
All right. Thanks for watching, everyone. And I'll put Dr. Bob's information in the comments when I post it. Okay. So we will. Okay. Bye, everyone.